The alarms were screaming. The patient was flatlining. The lead surgeon had just collapsed from exhaustion after 18 hours of surgery. In the chaos, nobody noticed the security guard calmly washing his hands at the sink. They were about to discover that some skills never fade, and some heroes hide in plain sight. Welcome to Real Heroes Stories YT, where we uncover the extraordinary people walking among us in ordinary clothes. Before we begin this incredible story, tell me in the comments from which city in the world are you watching this video today. And if you believe stories like this deserve to be heard, hit that subscribe button to support the channel. We're growing every day, and your support helps us honor the silent heroes who never ask for recognition. The fluorescent lights of Memorial Hospital cast their usual sterile glow over the night shift corridors. It was 2:17 a.m. on a Tuesday, the kind of quiet hour when most of the world sleeps, unaware of the battles being fought behind hospital walls. In the security office on the third floor, Marcus Chen sat alone, his eyes moving methodically between 12 monitors showing empty hallways, parking lots, and the occasional nurse making rounds. Marcus had worked the night security shift for 3 years. 3 years of the same routine. Clock in at 11 p.m., patrol the floors twice per shift, monitor the cameras, and clock out at 7 a.m. The hospital staff knew him as the quiet Asian man who nodded politely when they passed, who never spoke unless spoken to, and who seemed to fade into the background like part of the furniture. He was 42 years old, average height, with graying hair that he kept short and neat. His security uniform was always pressed, his shoes always polished, but there was nothing remarkable about him that would make anyone look twice. The doctors hurried past him in the hallways, discussing cases and procedures. The nurses chatted about their families and weekend plans. Marcus simply listened, observed, and remained invisible. What none of them knew was that Marcus Chen had once been Captain Marcus Chen, Army trauma surgeon, deployed to 3 different combat zones over 8 years of active duty. His hands had saved lives in field hospitals, where the only light came from generators, where mortar rounds shook the operating tables, and where the difference between life and death was measured in seconds, not minutes. But that was before the IED explosion that killed his entire medical team except him. Before the survivor's guilt that ate at him like acid. Before he decided that he could never operate again, that he didn't deserve to hold a scalpel after failing to save the people who mattered most to him. On this particular Tuesday night, Marcus was reviewing incident reports from the day shift when the first alarm began blaring through the hospital corridors. Code Blue, Trauma Bay 2. He looked up from his paperwork, his trained ear immediately recognizing the urgency in the electronic tone. On Monitor 7, he could see medical staff running toward the trauma unit. Marcus had heard hundreds of these alarms over the past 3 years. They were part of the hospital's rhythm, as regular as shift changes and meal deliveries. Usually, the alarms would stop within minutes, the crisis resolved by the skilled medical team. This time was different. The alarms kept screaming. On his monitor, Marcus watched as more staff rushed toward Trauma Bay 2. Then he saw something that made his blood run cold. Dr. Williams, the chief of surgery, stumbled out of the trauma bay and collapsed against the hallway wall, his surgical gown soaked with sweat, his face gray with exhaustion. Marcus stood up immediately. Dr. Williams had been in surgery for 18 straight hours, trying to save a construction worker who had fallen from a building. The man had multiple internal injuries, and the surgery had been complicated by unexpected bleeding and organ damage. Marcus had watched the staff bringing in blood bags, calling in specialists, and preparing for what everyone knew was a desperate fight to save a life. Through the security cameras, Marcus could see the chaos unfolding in real time. Nurses were helping Dr. Williams to a chair, checking his pulse, bringing him water. But in Trauma Bay 2, the patient was still on the table, still fighting for his life, and now there was no surgeon. The head nurse, Janet Morrison, appeared on the monitor. Marcus could see her on her radio, probably calling for another surgeon. But Marcus knew the numbers. At 2:30 a.m. on a Tuesday, the only other trauma surgeon on call was Dr. Rodriguez, and he was 20 minutes away, stuck in traffic from another emergency across town. 20 minutes. The patient didn't have 20 minutes. Marcus found himself moving before he made a conscious decision. He left the security office, walking quickly but calmly down the corridor toward the trauma unit. His mind was already shifting gears, accessing medical knowledge he had tried to bury for 3 years. As he approached Trauma Bay 2, he could hear the frantic voices inside. The patient's vitals were crashing. The anesthesiologist was trying to keep him stable, while the surgical residents looked on helplessly, their training insufficient for the complex procedure that needed to be completed. "Where's Dr. Rodriguez?" someone shouted. "Still 15 minutes out," came the reply. "Maybe more." "We're losing him." Marcus stopped outside the door, his hand on the handle. Every instinct screamed at him to walk away, to return to his security desk and let someone else handle this. He wasn't a doctor anymore. He was just a security guard. He had given up that life, given up the right to make these decisions. But through the small window in the Trauma Bay door, he could see the patient's face. A young man, probably in his 20s, with calloused hands that spoke of honest work and a hard life. Someone's son, someone's brother, maybe someone's father. Marcus took a deep breath and opened the door. The Trauma Bay was controlled chaos. Monitors beeped frantically, displaying vitals that told a story of a body fighting desperately to survive. The patient was unconscious, his abdomen open from the surgery that Dr. Williams had been forced to abandon. Blood was seeping from internal injuries that needed immediate attention. 3 surgical residents stood around the table, their faces pale with the knowledge that they were watching someone die and couldn't do anything to stop it. The head nurse, Janet Morrison, was coordinating with the hospital's other departments, trying to find any available surgeon. Nobody noticed Marcus enter the room. He moved quietly to the sink in the corner and began washing his hands with the methodical precision of someone who had done this thousands of times before. The familiar ritual was automatic. Soap, water, scrub for 2 minutes, rinse, repeat. It wasn't until he approached the instrument table that Janet looked up and saw him. "Marcus, you can't be in here," she said, distracted by the crisis, but still aware of hospital protocol. "This is a sterile environment." Marcus didn't respond immediately. He was looking at the patient, his trained eyes taking in the surgical field, assessing the damage, calculating what needed to be done. The young man was bleeding from a lacerated spleen and had internal injuries to his liver. Both conditions were survivable, but only with immediate surgical intervention. "Where's Dr. Rodriguez?" Marcus asked quietly. "Still 10 minutes away," Janet replied. "Marcus, I need you to leave. We're waiting for—" "He doesn't have 10 minutes." There was something in Marcus's voice that made Janet stop talking. It wasn't the tone of a security guard making an observation. It was the voice of someone who knew exactly what he was looking at. Marcus moved to the surgical table, his movements calm and deliberate despite the chaos around him. He picked up a pair of surgical gloves from the dispenser and began putting them on with practiced efficiency. "What are you doing?" one of the residents asked, his voice cracking with stress. Marcus didn't answer. Instead, he looked at Janet Morrison, and she saw something in his eyes that made her step back. It was the look of someone who had made life and death decisions before. Someone who knew exactly what needed to be done. "I need suction," Marcus said calmly, his voice cutting through the noise of the monitors and alarms. The surgical residents looked at each other in confusion, but Janet Morrison moved without thinking. Something about Marcus's demeanor, the way he held himself over the patient, the confidence in his voice, triggered an automatic response in her 20 years of nursing experience. She handed him the suction device. Marcus began working immediately, his hands moving with the precision of muscle memory that 3 years of security work hadn't erased. He quickly suctioned blood from the surgical field, exposing the source of the bleeding. "I need a curved clamp," he said, his voice steady and sure. One of the residents, Dr. Sarah Kim, handed him the instrument without thinking. She was mesmerized by the calm efficiency of his movements, the way he seemed to know exactly where to look and what to do. Marcus located the source of the bleeding, a torn blood vessel in the spleen, and clamped it off with swift, precise movements. Immediately, the patient's blood pressure began to stabilize. "Pressure's coming up," the anesthesiologist announced, surprise evident in his voice. Marcus continued working, his hands moving with the kind of confidence that comes from years of experience in life and death situations. He repaired the lacerated spleen using techniques that the residents had only read about in textbooks, his movements economical and sure. "How do you know how to do this?" Dr. Kim whispered, watching in amazement as Marcus worked. Marcus glanced at her briefly, then returned his attention to the patient. "I used to be a doctor," he said simply. The trauma bay fell silent except for the steady beeping of monitors showing improving vital signs. Everyone watched as Marcus continued the surgery, repairing internal damage with the skill of someone who had performed similar procedures hundreds of times before. Janet Morrison moved closer, her nursing experience helping her understand what she was witnessing. This wasn't someone who had taken a few first aid classes. This was a trained surgeon, someone with extensive experience in trauma surgery. "Where did you train?" she asked quietly. "Army Medical Corps," Marcus replied without looking up from his work. 8 years, 3 deployments. The words hung in the air like a revelation. Suddenly, everything made sense. The way he moved around medical equipment, the calm way he had assessed the situation, the confidence in his surgical technique. "Why are you working security?" Dr. Kim asked. Marcus paused for just a moment, his hands still as he considered the question. Then he resumed working, his voice quiet when he answered. "Because I lost my team," he said. "IED explosion in Afghanistan. Everyone died except me. I decided I didn't deserve to operate anymore." The trauma bay was completely silent now, except for the sound of Marcus working and the steady beeping of the monitors. The patient's vitals had stabilized, and Marcus was methodically closing the surgical sites he had repaired. Janet Morrison watched with professional admiration as Marcus completed the surgery with textbook precision. When he was finished, he stepped back from the table, pulled off his surgical gloves, and looked at the monitors showing the patient's improved condition. "He'll be fine," Marcus said quietly. "The spleen repair should hold, and the liver damage was minimal. He'll need monitoring for the next 24 hours, but he should make a full recovery." As if on cue, Dr. Rodriguez burst through the trauma bay doors, having finally arrived from across town. He looked around at the quiet scene, taking in the repaired patient, the stable vital signs, and the group of medical staff standing around a man in a security uniform. "What happened?" Dr. Rodriguez asked. "I thought we had a code blue." Janet Morrison looked at Marcus, then back at Dr. Rodriguez. "Marcus performed the surgery," she said. "He saved the patient's life." Dr. Rodriguez looked confused. "Marcus? The security guard?" "Captain Marcus Chen," Janet corrected. Army trauma surgeon. Dr. Rodriguez studied Marcus with new eyes, taking in the man he had walked past hundreds of times without really seeing. Why didn't you tell anyone? Marcus was already moving toward the door, ready to return to his security station and his monitors. Because I'm not a doctor anymore, he said. I'm just security. But Janet Morrison stepped forward, blocking his path. No, she said firmly. You're not just security. You're the person who just saved a life. Word of what happened in Trauma Bay, too, spread through Memorial Hospital like wildfire. By morning, everyone knew about the security guard who had revealed himself to be a trained surgeon. The story grew with each telling, becoming legend. Dr. Williams, recovered from his exhaustion, sought out Marcus during his morning rounds. He found him in the security office, filling out his incident report as if nothing unusual had happened. Marcus, Dr. Williams said, entering the small office, we need to talk. Marcus looked up from his paperwork, his expression neutral. Is there a problem with my report? Your report? Dr. Williams laughed, shaking his head. Marcus, you saved a man's life last night. You performed trauma surgery that I'm not sure I could have completed in my current state. And you're worried about your incident report? Marcus returned to his writing. I was just doing what needed to be done. Dr. Williams sat down across from Marcus, studying the man he had worked alongside for 3 years without really knowing. Janet told me about your background. Army Medical Corps. Why are you working security instead of surgery? Marcus set down his pen and looked directly at Dr. Williams. For a moment, the carefully maintained mask of the invisible security guard slipped, and Dr. Williams could see the pain that Marcus had been carrying. Because the last time I operated, I was supposed to save my team, Marcus said quietly. 3 doctors, 2 nurses, 4 medics, all killed while I was in surgery, trying to save someone else. I couldn't save the people who mattered most. Dr. Williams was quiet for a long moment, processing this information. Then he leaned forward, his voice gentle but firm. Marcus, what happened to your team wasn't your fault. And what you did last night proves that you're still a doctor, whether you want to admit it or not. Marcus shook his head. I'm just security now. No, Dr. Williams said, standing up. You're a doctor who's been hiding, and I think it's time to stop hiding. Over the next few days, Marcus tried to return to his normal routine, but everything had changed. The hospital staff looked at him differently now. Nurses nodded with respect when he passed. Doctors stopped to chat with him about cases. The invisible security guard had become visible, and there was no going back. Janet Morrison was the most persistent. She appeared at his security station regularly, bringing coffee and conversation. We have an opening in the trauma department, she mentioned casually one evening. Dr. Williams thinks you should apply. Marcus didn't look up from his monitors. I'm not qualified anymore. My medical license expired years ago. Licenses can be renewed, Janet said. Skills like yours don't expire. Marcus was quiet for a long moment, watching the empty hallways on his screens. Finally, he spoke. What if I freeze up? What if I can't handle it? Janet sat down next to him, her voice gentle, but certain. Marcus, you didn't freeze up when it mattered most. You saved a life. That's what doctors do. 3 weeks later, Marcus Chen walked into Memorial Hospital wearing scrubs instead of a security uniform. His medical license had been renewed, his credentials verified, and Dr. Williams had personally recommended him for a position in the trauma department. The young construction worker he had saved, Tommy Martinez, was there for his follow-up appointment. When he saw Marcus in the hallway, he stopped and smiled. Hey, you're the security guard who saved my life, Tommy said, extending his hand. I never got to thank you properly. Marcus shook his hand, still adjusting to being recognized for his medical skills rather than his security badge. "How are you feeling?" "Perfect," Tommy replied. "The doctors say I'll be back to work in another month. My wife says I owe you everything." Marcus smiled, the first genuine smile his colleagues had seen from him. "You don't owe me anything. I was just doing what needed to be done." That evening, as Marcus finished his first official shift as a trauma surgeon in 3 years, he found a note taped to his locker. It was from the construction crew that Tommy worked with, thanking him for saving their friend's life. At the bottom, someone had written, "Heroes don't always wear capes. Sometimes they wear security uniforms." Marcus folded the note carefully and put it in his pocket. Then he looked around the trauma bay where he had revealed his true identity, where he had stopped hiding from who he was meant to be. Dr. Williams appeared beside him, checking on the evening's patients. "How does it feel to be back?" Marcus considered the question, thinking about the 3 years he had spent watching life and death from security monitors instead of participating in the fight to save lives. "Like coming home," he said finally. 6 months later, Marcus Chen was named the head of night shift trauma surgery at Memorial Hospital. He never talked about his military service unless asked directly, and he never sought recognition for the lives he saved. But everyone who worked with him knew that they were in the presence of someone special. The security office on the 3rd floor was taken over by a new guard, a young veteran named David, who had recently returned from overseas. Marcus made it a point to stop by and chat with David during quiet moments, understanding the challenge of transitioning from military service to civilian life. "Ever think about going into medicine?" Marcus asked one night, noticing how David watched the medical staff with interest. David shrugged. "I was a medic in the Army, but I figured that was over when I got out." Marcus smiled, remembering his own journey from the shadows back into the light. "Skills like that don't expire," he said. "Sometimes you just need the right moment to remember who you really are." As Marcus walked away, David watched him go, seeing not just a successful surgeon, but proof that it was possible to find your way back to who you were meant to be, even after losing yourself for a while. The quiet night security guard had become Dr. Marcus Chen again, but he never forgot the lessons he had learned during his 3 years of watching from the sidelines. He understood the value of quiet observation, the importance of being ready when called upon, and the truth that heroes often hide in plain sight until the moment when they're needed most. And in the trauma bay at Memorial Hospital, lives continued to be saved by a man who had once thought he didn't deserve to hold a scalpel, but who learned that sometimes the greatest service comes not from the recognition you receive, but from the person you choose to be when no one is watching. Now I ask you, have you ever met someone who carried hidden talents, someone who seemed ordinary until circumstances revealed their extraordinary abilities? Share their story in the comments below, because at Real Heroes Stories YT, we believe that the most powerful stories are about the everyday heroes walking among us. If this story moved you, please subscribe to our channel and hit the notification bell. We publish new stories of courage, redemption, and hidden heroism every week. Thank you for watching, and remember, you never know who might be the hero in disguise standing right next to you.